Welcome to Mother's Mic. Salman Apari Mabrook is my name, and I am your host. Today, we have an amazing guest here. She's not only a dedicated nurse, she's also an accomplished author and a media personality. Welcome, Nazifa. Welcome to Mother's Mic.
Thank you very much.
Who is Nazifa and what does she do?
Auzubillahi minash shaitanir rajim. Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Thank you very much for the question. Nazifa, that's my name, like you rightly mentioned. I'm a Dagomba from Tamale, to be specific. I grew up there. I attended all my elementary and high school education there, and also my nursing profession. I attended my nursing school in Tamale, and I started my early nursing after completing the nursing school also in Tamale, specifically in the Savuligo Nantong district where I actually come from.
Okay.
Then from there I moved to the Greater Accra region on transfer. Currently married with 3 kids, and I'm still in the health profession.
Okay.
So briefly, that's what I can say about me for now.
Okay. So, Nazifa, what inspired you to go into nursing?
That's an interesting question. As a matter of fact, growing up as children, there are times we all decide on what kind of profession we want to be.
Right.
There are times we stick to the professions we mentioned. It's our dream, and a few people grow up to actually become what they have wanted to be. Some do change along the line. So on my part, growing up, I had wanted to read law or do journalism. But when I completed my high school, when I wrote the SSCE, I had some challenges with my results that could not permit me to go into the law school. But the grace could take me to the nursing school. So my mother advised me to start with the nursing, then better the grades, then I can go and read law. So my going into nursing was something to start with, like something my mother said, a stepping stone, so that I wouldn't be sitting in the house idle. And most of those professional institutions, when you start schooling during vacation, you are not allowed to stay at home. They assign you to various hospitals or healthcare centers where you do the practical part of the work. So the nursing profession is, I think, 30% academic and 70% practical. So during our practical period, like, that was when I fell in love with nursing. Okay, the joy I saw on the faces of people after I had rendered a service, and the prayer from patients or clients relative, it got to me.
Inspired you?
Yes, it got to me. And at the point I told myself, so am I going to turn my back on these people if I choose to go and read law? What happens to them? So I called my mom and I told my mom that no, I think this is the best profession I can ever do. It wasn't part of me, but I fell in love with it and I stuck with it till now.
Oh, that's interesting.
Yes.
So, aside nursing, is there any other thing you do?
Nursing generally is about giving care to patients, giving education, health education, and that is one of my passion, like health education. I do a lot of health education. I started with community health nursing, and with community health nursing, we deal more with prevention than cure. Sometimes it's heartbreaking to see people report to the hospital with conditions that can be preventable. Okay, with just a simple step, that this condition could have been prevented. So it's all boiled down to ignorance or lack of knowledge on how to prevent some of these things. So that's what got me into the community health nursing. But after that, I realized that the education we gave as community health nurses was or is limited. So I decided to go and do a program in College of Health Kintampo, and that program is called Health Promotion. So health promotion is specifically directed to creating awareness. Okay, so we do more awareness creation because I felt that the education was not going down well. So I dedicated my time and my resources to do the health promotion. And as we speak now, I've shifted from the actual nursing practice to health promotion. So I do a lot of TV program. I go to churches, I go to mosques, I go to like corporate institutions, schools. I meet professional institutions like hairdressers association, dressmakers associations, barbers associations, and even within the churches we have women's group, men's group. Once a while I go there to give them education on one health condition or the other. Then also I write. I write books sometimes, and all this is inspired because of my profession, my nursing profession. So currently my maiden book, the very first book I wrote, was launched in 2001, and the book is titled Holiday Adventures. Holiday Adventures. And this was inspired because of the number of cases caregivers reported to the hospital with. It was heartbreaking. As a mother and as a nurse, you see a mother rush into the hospital with a child involved in an accident that could have been easily prevented. So I was stationed at the reproductive and child health unit, so I dealt with children. We gave vaccination and everything, children. So seeing a child suffer through no fault of his was heartbreaking. So I said to myself, what can I do to at least minimize this incidence of accidents in children? These children are our future leaders, of course, so you can't, out of negligence, allow maybe such a child to become deformed due to an accident or carelessness. So I thought to myself, what can I do to curb this situation? Then the issue of writing a book came to mind, a storybook. So like I titled it Holiday Adventures. The storybook is about...
Oh, we have that here.
Yes, I have a copy there. Holiday Adventures, yes. So the title Holiday Adventures is because most children stay at home during the holiday season, and a lot of the time some people travel to other places. So Holiday Adventures is about two families, one in the rural community, the other in the urban community. And like during the first holiday, the family from the urban community traveled to the rural community, and you know, children, like they saw a lot of things they have only seen in books or on TV, like things like a donkey, a well, a farm. All these things are common in the rural areas, and children from the urban areas are not used to it. And most of these things poses threats or danger to the kids. Imagine a well. We, those who come from the rural communities, we have heard or seen instances where a child has fallen in a well. It's very dangerous. The well serves a purpose. It gives us water, but it's also dangerous. We take children to the farm. You know, the farm, anything can happen. We have bushfires happening on the farm. We have these thorns that we find in grasses that can prick anybody. We have reptiles and other things in the soils that can sting or bite a child. So all these places where we take children, we have to take caution. Then we have most people from the rural communities also visiting the urban communities, and there are a lot of things they haven't seen. So like in the city, we have a well-designed swimming pool. We think like it's nice, it's beautiful, but do we know the danger or threat it poses? People drown in the swimming pools, just like in the village we have rivers where children go to swim. The only difference is the hygiene, like the cleanliness. The city has a beautiful swimming pool, but the rural area is just a river where dirt and everything is in. But all these people do drown. In the city we have roads, we have these overhead bridges where people from the rural communities have never seen. So It's very interesting book. It was also meant to encourage reading. You know, this is because of our phones and TVs. A lot of children don't read. So I intended to kill two birds with one stone. I wanted to promote reading and to also give some lessons on how to prevent one accident or the other. So if you read the book, you see that those from the rural community, when they came to the urban, they had a lot to learn. They learned about the zebra crossing,
Okay.
how to use some of electrical gadgets.
Okay.
And the people from the rural community to the urban, when they went to the rural, they got to know how to be safe, how to prevent bushfires, how to do a lot of things that can give us accidents, how to prevent them. So that is how Holiday Adventures came about. And honestly, it's an interesting read. All those who have purchased a copy have called to confess what the child or the children have learned from it.
That's interesting. So basically, your experience as a nurse has also influenced you being an author, and then your media personality as well.
Exactly.
Okay, as a Muslim woman navigating through the health sector, have there been any challenges that you have faced?
Yes, of course. And you know, like I mentioned earlier, I started my nursing career up north, where it's a Muslim dominated community. So as for that place, I didn't have any challenges. But when I moved down south, you know, as most of the time I find myself being the only Muslim among colleagues, or maybe among the few Muslims, because here is a Christian dominated city, let me put it that way. And sometimes the challenges is more on stereotyping, like yeah. A lot of the time you are doing something, it's time for you to pray as a Muslim, you are not given the chance. And that one, it depends on different individuals, because I've worked under a few who don't mind, but others will tell you you haven't closed, so you can't go and pray as a Muslim, so you have to deal with that. Then sometimes, so not me in person, but the way some of the health workers relate to other Muslim clients or patients is heartbreaking. And there is an assumption that most of us who are Muslims, we have little education. So sometimes when they come, some of the health workers do belittle the intelligence of the Muslim community. They assume maybe we don't know this, we don't know that. So I take it as a challenge, and I try to explain or educate some of my colleagues on some of these things. So it's actually having been a bother or a worry to me, but it's like something I have taken interest in. I try to educate my colleagues on that. So gradually it's changing, because from where I come from, the way they related with some Muslim clients or patients is changing. So I'm happy about that one, and I'm still fighting that.
Okay, so what support system has been helpful to you as a Muslim professional in the health care sector?
Support system, I can say generally I have support system, and the support system too also depends on you, the individual, how you relate with others.
Okay.
Like I said, I'm not the only health promotion officer in town, but I do get a lot of invitation from churches. Okay, had it been someone, I would say maybe because of my faith, I would never go to a church to give education, but I don't mind. And because of the way I relate with them, they do invite me a lot. Because, for instance, when I go to a church to give education, they are Christians, I'm a Muslim, but we all worship one God. So before I start, I ask them to say a prayer. They say their prayer, I respond amen. When I'm giving education and I realize that maybe the attention is down, I go like, praise the Lord. That is what they know. Do you understand? So because of that, I identify with them. and they are always happy. So when it comes to that part, I think I have a lot of support, and from the Muslim community too. Most of the time, especially during Friday prayer, I go to one mosque or the other to give education, and it's always welcoming. So with the religious institutions and some other individuals, I don't think I have so much of a problem with them. Religion doesn't make us different. That is their way of worship. I have my way of worship. But once I'm in their environment, their vicinity, I identify with them, and what they want, they get. What I have to give them, I give them.
Okay.
Then we move.
Okay, so as an author and then a media personality, how do you use your platform or opportunities you get to address issues related to Muslims in the health sector?
Okay, so sometimes it's difficult with the media aspect, because we have a lot of private stations, and most of them are into business. They have paid programs they do, so sometimes before you get an airtime, it's usually very difficult. But thank God, we have seasons or times for everything. Sometimes when it comes to a period like Ramadan or Eid, like they also need people to come and give this kind of education, so that is when they count on me, and I also use that opportunity to give my best. Then also when it comes to the health aspect, the World Health Organization have assigned certain months or days for certain health conditions. So we realize that October is the most famous. In October like this, we do breast cancer. December we do HIV.
Okay.
I think recently April we did malaria. Then last month was, I think, something related to mental health.
Yeah.
So some of it's
mental.
Yes. So some of the celebrations take a week, others take a month. So within that week or month, you are able to lobby with a media station for some airtime where you can do education. But aside that, like I mentioned earlier, we do go to corporate institutions, and I have passion for school kids, like from basic level to secondary school level. So some of the schools too, I do go there once a while, and I give education to the students.
Okay, so can you share any experience that you have actually experienced where the public has actually given awareness to asking all these issues that you're talking about? Have there been instances like this that you have also experienced?
Yes. Like I mentioned earlier, I do get a lot of calls, and this is because like individuals I have interacted with do recommend me to other people, and that gives me so much joy. As a matter of fact, I feel happy when I get a call and told me that I was asked to call you by this person. This is my condition. It makes me happy than getting a bank alert that salaries have come, because I know the person needs my help, and I'm ready and willing to help that person. I went to Hajj with the medical team in 2013, and I just want to share this experience. So with the medical team, far in Saudi Arabia, I was on duty one day when a lady was rushed in. She was almost unconscious, and she was crying because at the time we hadn't started the real Hajj. We were waiting for the time to be up. And these women, a lot of them are diabetic, they are hypertensive, and when they come, they are curious. They want to see everything, they want to eat everything, especially that sometimes they come to distribute free food.
Good.
It's unfortunate, but some of our mothers, they will take like 6 packs of food. They know they can eat all at once, but they will keep them. So this man was brought in almost unconscious. She was crying, and at the time the doctor had gone to pray, so I was the only one in the clinic. So I calmed her, I checked her vital signs, that is her BP, her sugar and everything, and they were high. Both BP and sugar levels were high. So I told her that, see, madam, you know that Mom, I addressed my mom because she was older. I said that, Mom, you are not the only person who have paid to come for Hajj. A lot of people have, and you know that a lot of people have paid but haven't gotten visa to come. She said yes, and I said, the fact that you are now in the kingdom of Saudi Arabia, that should tell you that God wants you to perform Hajj. So don't cry. She said no, that the son has paid a lot of money, and the way she's feeling, she thinks she's gonna die. So I spoke to her. I was speaking to her when the doctor came, and I feel sad to say this. This very doctor passed on just yesterday. Dr. Mohammed Ubunwaya. Yes, may Allah have mercy on his soul. He was the medical team leader for Hajj. Dr. Ubunwaya, rest in peace. So I was with the woman when doctor came in, and she checked the vitals and gave the woman some medication and asked her to come in 3 days time. And at the hospital, the shifts we rotate. Sometimes they'll take you from one department to the other. So back in Saudi, I was taken from that clinic to another clinic. So when the lady came for review, unfortunately I wasn't there, and I didn't tell her my name, where I stay, and blah blah blah. So we lost contact. One day in Ghana, at my facility, I was there when a lady came with her son. I think she came for checkup. So she saw me, and the way she was looking at me, I knew like something was up. So I approached her and I greeted her. Then she asked me, "You look like somebody I know. Have we met?" And I said, "I don't think so." She asked me, "Have you been to Hajj, Saudi Arabia?" And I said, "Yes," which I mentioned. Then she asked, "Are you a nurse?" And I said, "Yes." Then she told the son she's the one. So I was scared. I was like, what have I done? Then she reminded me, back in Saudi, I was brought to your hospital. This was the conversation we had, and blah, blah, blah. So she told me in Hausa, she said, "My daughter, I can swear to you that it's not the medicine doctor gave me that made me feel better. It's your words, the reassurance, the encouragement that you gave me, that is what healed me." And she told me, "Keep it up." And I was very excited because, you see, when you go to nursing school, there are 3 things. If at all you don't learn anything for any reason, there are 3 things you should have at the back of your mind. First is hand washing to prevent infection. So you see that even me in my house, like, we waste water a lot due to hand washing. Before or after a procedure, you need to wash your hands. Then the second thing is reassurance. Even as a health worker, if you know a patient is going to die in the next minutes, you can't disclose it. Reassure, give the person hope. Then the last thing is explain procedure. These are laid down protocols. Whatever you are doing to a patient, you explain procedure. Now, let me give you one reason why my mother tricked me into nursing, because that was a trick. I mentioned earlier that she said I should start as a stepping stone. In 1999, at the age of 13, I was diagnosed with appendicitis, and I was taken to the teaching hospital in Tamale. At the time, technology was not as advanced as today. So when they did all their investigations, it turned out that I had appendix, and the surgery had to be an emergency one, otherwise I may die. So they asked my mother to take me to the ward, but unfortunately they didn't explain to my mother, "This is the condition of your daughter." So my mother took me to the ward, and knowing that I hadn't eaten for a long period, she went out to get me something to eat. And with surgery, when I went to do operation, you are not supposed to eat anything. So my mother got some food for me. I was eating when the nurses from the theater came to prepare me for the surgery. And when they came and saw that I was eating, they were angry.
No.
And one of them said to my mother, "Why did you give her food? It's an emergency surgery. We have to operate on her. The doctor is waiting at the theater. Pray that she survives till tomorrow." A nurse said this to a caregiver, a mother for that matter. So my mother was shaky. What condition is it that they are telling me to pray till my daughter survives till tomorrow? So the rest of that day, I didn't eat anything. I was put on infusions till the day of the surgery. Thank God I was alive till then. So the day of the surgery, early morning, I was sent to the theater. Then my mother couldn't do anything. Of course, she was standing close to the theater, and Few hours later, according to her, a nurse was coming out of the theater. Then she asked the nurse, "Madam, my daughter has been sent to the theater since morning. I haven't heard anything. What's going on?" Then the nurse was like, "They've called for the specialist to come. A lot of doctors are by her, but they can't do anything, so they've called for the head of the surgeons." Then my mother got scared. What kind of condition at all is it? You see, all these panics, if they had explained the procedure, like everything, so she would have been calm. So she stood there for more hours. So another nurse was coming. Then she approached that nurse again and asked, "Madam, my daughter has been sent to the theater since morning. What's going on?" Then the second nurse said, "When your children are sick, you don't bring them to hospital. You wait till they are about to die. Or you bring them to worry people." My mother said at that point she couldn't feel her legs. Just yes, yes. So this are not the kind of words we should use as yes. So my mother felt so hurt. So according to her, we are five children. I'm the second out of the five, and according to her, she knows my character and she wanted me more in the nursing profession than any other profession. Okay, but she knows that she couldn't force it on me. So because I couldn't get my choice immediately, she asked me to do the nursing as a stepping stone. So when I told her I wouldn't read the law or do the journalism again, I'd fallen in love with nursing, she wasn't surprised because she knew, according to her, she knew I would not see sick people and turn my back on them. So that was her trick, but I didn't know until he confessed to me.
Oh, that's interesting.
Yeah,
What advice do you have to young ones who want to also go into the health sector and also want to go into the media sector as well?
Okay. So it's unfortunate that in recent times people go into nursing because they think they have no other option or because they feel like there is money in nursing.
Okay.
It's a sad thinking. That is not the truth. But I want to encourage people that sickness is not bought. Nobody ever gets to buy sickness for him or herself, even if it is done. Maybe it's out of ignorance. Sickness is pain. So let's not take the sickness and the weakness of individuals for granted. If it is us, the way we treat other people, we wouldn't want others to treat us that way. So as a young nurse, you have to take the health of individuals seriously. If you have the opportunity like I do, make sure you talk more on prevention. Prevention is always better than cure. It's cheap to prevent than to treat. So I will encourage all nurses to help as much as possible for us to decrease the incidence of diseases and to also encourage them to treat the patients with dignity, respect, and with professionalism, and to put aside conflict of interest. In this day and time, it's common to see a nurse selling some kind of medicine or supposed medicine to clients, all in the name of making money, but not in the interest of making the clients recover quickly. So I think we should desist from that and stick to the Ghana Health Service standards of treatment guidelines and professionalism.
Okay. So Nazifa, are there any platforms that we can reach out to you? Maybe there are others who want to learn more from what you have said today. Are there platforms that we can reach out to you so that we can keep learning every day?
Okay, so unfortunately I'm not a social media person, but I'm active on Facebook. I'm on Instagram, I'm on TikTok, though I'm not very active on Instagram and TikTok, but I'm there. I do respond to messages there if asked. Then personally, I have an office at the East Municipal Hospital. I'm the head of the health promotion department there, and I'm always a call away if you need any clarification on any health condition. And if you don't mind, I could mention my phone number. Okay, so my phone number is 0244 251 352.
Okay.
0244 251 352. And I must add that just a few weeks ago,
Okay.
I was nominated under two categories for Islamic Personality Award, which will be coming on in September.
Interesting.
So I've been nominated under the Best Authorship category and the Female Leading Role Model category. So thank you. So voting is ongoing. If you want to vote for me, you can call me. I'll give you the nominee code. Then we can take it from there.
Thank you so much. Thank you for honoring our invite. We appreciate you being here, and thank you for educating us today.
Thank you very much.
Okay.
Call away if you need me to educate you on anything. Thank you.
So we heard from our guest. We heard all she had to say concerning the media side and then her the health sector side too. And I know we learned a lot from her, and we are willing to learn more and more each and every day. She shared her social media platforms. She's put her number out there. So call her when you need more. And don't forget to subscribe, comment, like, and share. Usamana Parimabrick is my name, and I am your host.